This is actually quite good. This is a queue for the supermarket in Kuala Lumpur in Malaysia. So we see this chap here patiently waiting, then the queue goes round here like this. Then it goes across there. It's a U-shaped queue, so you can see nice social distancing here. Reasonably good anyway. And the queue goes back up here and into the supermarket there. So they're obviously only letting a few people in the supermarket at a time. And it is completely compulsory to wear masks in the supermarket. And I really think it's time that we did that as well, that it should be compulsory to wear masks in the supermarket. So, welcome everyone. It is Monday the 20th of April. Thank you for coming back. Now, I want to do a bit of a global update today. And for a long time, I've been very concerned about the situation in many African countries. So today I want to focus quite a bit on the African situation and some of the particular problems that there are in that often difficult situation. But first of all, let's start off with a bit of a news update. So this is the number of official cases in the world, nearly 2.5 million. That's the number of official deaths. Now, the United States, things are still increasing if we take it from a countrywide point of view. Very much on the increase. So there's about 150,000 tests a day, I think, being carried out in the States at the moment. And so far that's turned up 750,000 confirmed cases. We know the real number of cases, of course, is way higher than this. The death figure is probably much more accurate, and 41,000 deaths now in the United States. So already a tragic, monumental amount of deaths already in the United States. And I'm afraid more to follow, I'm afraid. Now, there seems to be big debates in the States at the moment, a lot of shutdown protests. People protesting about the lockdowns, and you can understand this because people need to make money to support their families. So I'm not saying I don't understand it, but everyone needs to move together. I think that's the problem. So huge shutdown protests. So, for example, Texas has got rising cases, but progressively reopening parks and takeaways from next week. So there's a real conflict in the states here, and it really seems that the central government and the state governments are at, well, as an outsider, it looks like they're at loggerheads, which isn't good. A house divided against itself really can have difficulty standing. If it's very divided, a house won't stand. So let's hope there's some more concord breaks out in the states there and a more unified approach. Again, Florida Beach, I think it was Jacksonville, reopened. So socio-political difficulties there. I think that's a mild way to put it, but yeah. So New York hospitals. Now, slightly good news here. New York hospitals, the number of admissions is slightly down for 4 days now. So that's encouraging. Everyone in New York's wearing masks in public, which is also good. Masks probably aren't going to protect me from getting the disease, but they're going to stop you from getting disease from me. Now, a lady called Andrea gave me an immortal phrase: keep your droplets out of my mucous membranes. Great turn of expression. So by you wearing a mask, you're going to protect me. And I would ask you to keep your droplets out of my mucous membranes. New York City, more deaths. That's actually a bit out of date now. I'm not quite sure what the latest figure is. But 14,000 deaths in New York City alone, 14,500 deaths. Now, I was listening to Governor Cuomo today, and he was saying that New York planned 3,000 antibody tests so they can assess the prevalence of infection in New York. Now, this might not sound like many for the entire population of New York, but if this is done correctly as a proper randomised sample, then that will give a very accurate picture of cross-sectional data for what is going on in New York in terms of how many people are actually infected with this COVID-19 virus. And we know it's probably going to be a reasonable percentage of the population that are already infected. But what it is, we really should know. Now, as long as that's done properly, and I'm sure it will be by proper scientists who know how to pick randomised samples, how to organise randomised sampling, then that will give us an accurate, hopefully by about this time, in a few days' time, we should know pretty accurately what the situation is in New York. Now, in the States generally, 150,000 tests a day. And I heard a university saying, I think it was Harvard, I'm not sure, but to lift the lockdown effectively, they need getting on for 500,000 tests a day, 450,000 a day. So even though the testing in the States is ramping up, even although it's identified a lot of confirmed cases, it's still not enough for the test, trace, treat, isolate strategy that was successful, for example, in South Korea. So really the United States needs to be at least tripling the amount of tests that it's doing so it can fundamentally change its strategy and start lifting the lockdown safely. Whether the lockdown's lifted unsafely or not, that's a matter for internal American decision making, but at the moment it's, as we've said, it's problematic. Now, Los Angeles County, there's increasing number of cases as well, and the deaths are increasing there. That's the highest death rate they've ever had for a day in Los Angeles County. And of course, the deaths are lagging behind. So if there's been more spread in Los Angeles County, then unfortunately the death rate may rise. And that's despite good levels of lockdown, very often in California. Massachusetts looks like being another area where there's a lot of cases developing now. Now, if you watched it earlier on today, if you're up early, you saw I did a video on the contrasting the Theodore Roosevelt aircraft carrier and the Diamond Princess cruise ship. And I've been sent this update from I've nowhere verifying it, but it looks accurate. Email update. 672 positive now cases on the Theodore Roosevelt, including the former captain. Now 8 hospitalised, 1 in intensive care, and we know that tragically there was 1 fatality. And we know that most of the crew are now quarantined in Guam. So that seems to be a more updated thing on the Theodore Roosevelt. Now, if that's accurate, that means there's 8 hospitalised. That means of the infected cases, 1.1% were hospitalised. Now, yesterday I said this is a young and active crew. That's still basically true, but I have been told that quite a few of the crew are slightly older, in their 40s, for example, maybe some in their 50s. So there is some older members of crew there, although most of it is still young adults. And I also assume that sailors spend a lot of time in the fresh air, but I've been told in this situation very often they don't. They're below decks a lot of the time. So looks like I had a couple of misconceptions there. So 8 hospitalised, 1.1%. ITU, there's 1 person in ITU. That's 0.14%, and 1 death, that's 0.14%. So we wish everyone who's hospitalised in intensive care well, and we send our condolences to the relatives of the sailor whose life was lost. So interesting update there on that. Again, you know, for a youngish population, a fit population, these figures do ring true. They do seem to be about right. Now the UK, my country, increasing confirmed cases. Now this was the deaths on Sunday. That was on Sunday. So that was on Saturday. That must have been Friday. That must have been Thursday. Deaths. Now, it looks like there's dramatic reduction, but we have trouble reporting at weekends. So sadly, I strongly suspect the real number of deaths was nearer, or in the 800s, when the reporting finally catches up after the weekend, I'm afraid. So it looks like the UK could well be the highest death rate in Europe. It's certainly heading in that direction. Already we've got over 16,000 deaths. And these are deaths in hospital. They do not include deaths at home. They do not include deaths in care facilities. So the real figure could easily be easily be 50% higher than that, quite easily, I'm afraid. Now, there's been surveys done in my country, and there's quite a lot of support for mobile phone tracking. So I think there's an app now that I intend to download. At the moment it's optional, but this is an app you can download to show that your level of risk, and this is what works so successfully in China. Now, I know there's people all around the world having apoplexies now about the civil liberties implications of that, and I agree, but I'm just reporting that the data from my country seems to show that most people would support this on a temporary basis. And I know someone's going to email in and say, well, it won't be temporary, will it? But I'm just reporting what it says. Personally, I'm going to do it. UK prisons. I've been warning really about prisons for a long, long time now. We saw outbreaks in prisons in Iran, in China, in earlier days. Now in the UK, half prisons have cases. 255 prisoners are now positive in 63 different establishments, and 138 staff are positive in different establishments. And this is going to be a problem all round the world. Wherever people are in close quarters, living in close proximity, especially with indoor environments, there's going to be spread in those environments, as we've seen in nursing homes. And all around the world, we have already seen problems in prisons. Wish I had an answer for that one. We are looking at letting people out of prisons who are low risk in the UK, but they don't seem to have quite got their act together yet. Now, it's been announced that there's a national study now on convalescent plasma therapy trials in the UK. Now, what is this? Now, this is people who've had the virus, and when someone's had the virus, they will develop antibodies to it. They will have these immunoglobulins in their blood, and they will have immunity to it, we believe. And there's provisional data showing that if you take blood from these people who've had the disease, and then what the clever people in the haematology laboratories do is they separate the blood and the plasma. Now, we do this all the time in healthcare anyway. So these days, I haven't given whole blood for ages and ages. We do sometimes in trauma, but virtually always when we give blood transfusions in hospitals now, it's packed cells. So the cells, the cell part is separated from the plasma part, and you get this straw-coloured fluid on the top, the plasma. And it's the plasma that contains these soluble antibodies, or the antibodies which are present in the plasma. So that's great because you can use the red cells and give those to someone who's short of red cells. Then you can give the plasma to someone who needs the antibodies. So what this would actually involve is giving the infusions of plasma from people that were infected because they have the antibodies in their plasma. And these antibodies are the immune proteins. And these antibodies that someone else has already made to the virus, to the antigen, will still work against the virus. This is actually an example of what we call passive immunity. So, for example, when a baby's born, they've got antibodies from their mother in their circulation that's going to keep them immune to things for several months after birth. Or in breast milk, mothers give out antibodies in the breast milk that then colonise the lining of the child's gastrointestinal tract and provide a lot of immunological protection. So the child is enjoying immunity that he did not actively make himself. His or her mother made it. And it's the same with this. So if I'm sick, I have the virus, I have the antigen, I make the antibodies, you then take my blood, I give you my plasma if you're suffering from the illness, and my high levels of antibodies in my plasma will beat up the virus in your system, causing the infection. So it makes perfect sense. And that's been trialled at the moment, and it's quite a rapid trial, so hopefully there'll be results out on that quite soon. And it is showing promise on other parts of the world, so it's these plasma infusions. Now, I didn't know this, but apparently one donor can give to 3 recipients. Now, that's interesting because to me, that means there's quite a lot of these protective antibodies in someone's plasma after they've recovered from the illness. And this also indicates that these people will not recatch the illness themselves. So if this works, it's further good news for people being immunologically protected by their own active immunity after they've been exposed to the virus. despite what the World Health Organization is saying, that some people don't develop protective antibodies. Now, it may well be true that some people don't, but if this works, it indicates that many people do. So this is encouraging. And apparently this was tried in Ebola. It was tried in the severe acute respiratory syndrome 2002-2003. And I didn't know this. Apparently it was tried way back in the days of the Spanish flu with some benefit, which is 1919, when 50 to 100 million people died in that terrible pandemic. So interesting. So things of concern there, but interesting potential treatment there coming up. And you might remember the immunological professor that we talked to in Iraq was also a great advocate of this convalescent plasma theory. Now, China, there's an outbreak in the northeast, cases that have come over mostly from Russia. So that's being contained in China now. But that indicates there's probably quite a lot of cases in Russia if the cases are coming across the border. The border is now sealed between so it'd be southwest Russia and northeast China. Now, Turkey, there's a great increase in number of cases. This is a couple of days ago, but there was an extra 3,800 cases. So quite a high number of cases now in Turkey, and the deaths increasing. So it looks like Turkey are very much on the upward slope of their curve. So I think we can expect a lot more cases in Turkey, unfortunately. Greece, probably a lot of underreporting there. The reason I put it on today was there's been a lot of tension in migrant camps in Greece. People living in very often in tents or temporary accommodation, very often all crammed together. And they've been cordoned off from the rest of Greece, and they're developing their own medical facilities. So potential epicenters they're developing in migrant camps in Greece. It's this situation again, isn't it, where lots of people are crammed close together and don't have the option of spreading out as much. France, still in lockdown, France, and nearly 5 weeks now. But it looks like the curves are levelling off now in France. It looks like it's working. Italy. We kind of know the situation in Italy. Again, the stringent lockdown measures in Italy and Spain have reduced the curves, and there is reduction in cases, and they are looking at progressive reopenings now in Italy and Spain. But I did notice that there's some migrants who were trying to get into Italy quarantined at sea. And we've already looked at 2 examples of ships today where there are significant problems. So quarantining people at sea is uncomfortable. And if you have 0 cases, it's fine. But if you have 1 case, then it could spread around the entire ship. So that is, I'm concerned for the people quarantined on those ships at the moment. Germany, quite a success story, Germany, in many ways. We noticed the death percentage is increasing. That's probably about 3% now, or 3 point something percent. They're starting to ease some restrictions. Angela Merkel has said there's a fragile initial success. One of the things about Germany is Angela Merkel, of course, is a famous physicist. And whether you like her politics or not is irrelevant, but it doesn't alter the fact she's a proper physicist. She's a proper scientist. And the chief of staff there is an emergency medical physician, as far as I know. So I find it tempting to say that we need more scientists in senior posts in government who understand these things at an early stage. Nothing wrong with being a lawyer, but so many people in government seem to be lawyers rather than scientists, doctors, engineers. Anyway, now in Germany, they are developing an app as well, a monitoring app. So that's interesting. And there does seem to be a fair degree of public acceptance for that. So this idea of apps to monitor risk and almost to act as a passport is gaining credence, whether you like it or not, in quite a few countries. After its success in Taiwan, China, South Korea and Hong Kong. Norway, again, done better than quite a few other European countries. Now, the Norwegian government are saying they have control of the virus, And the Norwegian government, unlike others, is an open government. So if they say they have control of the virus, that probably actually means they do have control of the virus. So that's remarkably encouraging. They did begin the lockdowns early March. I think the schools closed down about mid-March in Norway. And they're looking at a very staged, cautious reopening. And they've launched an app in Norway, and so far 10% of the entire Norwegian population has downloaded it in just a day, I think, and is starting to use it to monitor movements and monitor risk. So I would expect that to become very popular in Norway, and I would expect that to be a very effective tool in curtailing, dampening down, flattening the curve in Norway. South Korea also using apps. 8 new cases is the lowest number of cases in 2 months, I believe, in South Korea. Yeah, lowest for 2 months. I wrote it down there. Death rate is increasing in South Korea as we anticipated officially. If you take 234 and that number there, that gives you 2.3%. Lockdown's always been limited in South Korea, but they're doing very good testing, tracking, tracing, isolating. This has been the key. Test, track, trace, treat, isolate is what they've been good at in South Korea. Now, Russia. Oh, the other thing I was going to say about Germany is they developed their own test in Germany, so very advanced testing in Germany. Why we just don't all copy the German test, I don't know. I mean, everyone seems to be kind of reinventing the wheel on this one. It's a bit strange. Anyway, that's a political question. But if the German test is working, I'd be more than happy to travel, wouldn't you? if it's working. Now, Russia, the cases, another 6,000 dramatic increase in Russia. This is underestimated. This is probably underestimated. So I really am very concerned for the situation in Russia. The healthcare infrastructure there has been neglected for years, and we know that there's spread across the border from Russia into China because everyone that's come across the border from Russia to China has been tested, and quite a few have been found to be positive. But Vladimir Putin said this yesterday: Russia has everything it needs. Situation is under complete control. That's what Vladimir Putin said. Now, Georgia, former Soviet republic there, not too many cases reported, but low levels of testing. And it did concern me that the Orthodox Church were having services there for their Easter, which I believe was the 19th of April. So that's concerning when these cultural issues seem to take precedent over the scientific issues. We've seen it in Islamic shrines, we've seen it in Orthodox churches, we've seen it in different churches, and we've seen it in mass religious gatherings such as that Islamic gathering in Kuala Lumpur that caused a lot of spread. This really is a time for being led by the science rather than being led by the culture, and feel completely free to pray and worship at home, just not communally at the moment. Online, at home, but not communally. Now Japan. I'm a bit bemused by Japan. We've shown pictures. Remember, we saw those. If you follow these regularly, we showed some lovely pictures of people sitting underneath the cherry blossom in Japan a few weeks ago, and we were just saying, well, where is the social distancing in Japan? It just doesn't seem to be there. Really quite concerning. There seems to have been a kind of denial in Japan almost about what's been going on. But the cases have doubled in the last 10 days. They've now declared a state of emergency. I must say, as we anticipated on this channel some weeks ago, I'm sad that it's happened, but we did anticipate it because they just didn't seem to be doing anything about it. The denial in Japan seemed to start with the Olympics. They were so determined that the Olympics were going to go ahead, which obviously wasn't going to happen from January. Anyway, low levels of testing. And the Tokyo health system seems to be overwhelmed. So I've read some horrendous stories about people with breathing difficulties in the back of ambulances who have been turned away from hospitals in Tokyo. Really quite frightening stuff. Now, India. Draconian lockdown in India. The police are very, let's just say, strict with people that break the curfew. So kind of waiting to see what's happening in India, really. At the moment, we don't know because there's such a low level of tests. Now, the medical infrastructure in India, in patches, is absolutely world class. And what the Indians are really good at doing is making things work, and normally doing it quite cheaply. So, for example, they were making HIV antiretroviral therapies years and years ago at really good prices. Top quality drugs, nothing wrong with them. And really quite proactive in terms of their medical technology. So I know the Indian scientists will be working flat out, and I strongly suspect the Indians are going to develop a cheap and effective test. But it's not there yet, so we really don't know what's going on in India. But I wouldn't be surprised if the whole world ends up using Indian tests once they get their act together, because hopefully they can make them at low cost, which the Indians are, as I say, very good at. Israel has done quite well. I mean, not too many cases, some deaths, obviously. And they're starting to lift some restrictions now in Israel. Again, quite a lot of population control to achieve this, but it does seem to be working. Now, Brazil has been... things are getting a lot worse in Brazil. Brazil seems to be the sort of South American epicenter, really. President Bolsonaro has described COVID-19 as the sniffle. You just get a bit of a sniffle in your nose and it goes away. This is just terrifying attitudes from leaders. A disease that could kill 1% of his population to describe as a sniffle is it's not good use of language. And healthcare systems should come under immense pressure later this month. They're challenged already, and they'll come under extreme pressure later this month. Now, I did say I'm going to focus on Africa, but I've had some problems uploading long videos at the moment, so I'm going to do a separate one on Africa in a minute. But I think what I'll do is I'll just show you a couple of pictures. I know what I'll do to show you. Actually, this one thing from Italy was brought to my attention. This is advice from Italy. But the social distancing one here is only 1 metre. Now, that surprises me. It is not enough. Let's say that again. 1 metre is not enough. So given all the measures that the Italians have been doing and the brilliant success they've had, why have they just got 1 metre on that? I don't know. Needs to be more than that. So that was quite interesting. Now this was really quite humbling, really. You know those COVID-19 things we put on yesterday, where someone sent that in, and I was going to tell you who sent that in, wasn't I? I do know. I'm going to tell you that in a minute. I've forgotten again. Anyway, so but people have sent me ones in different languages. So people have translated it into Italian. Sorry, there we go. Into Italian. And again, I'm making these available for download. Now, of course, I don't know what they say, so if you're Italian, you'll have to check it, but good that people have done that for us. And then all that other information there is also there in an Italian pro forma. So if the Italian authorities want to download that, check it and start using it, I think it would be a very useful tool. And this one is from Vandy, and this is in Thai. So he's translated it into Thai, which is really good of him. Yeah. Yep. Okay. We'll come back and we'll do the Africa one separately, otherwise it's going to take If I do it too long, it doesn't upload. I've had uploading difficulties, so we'll leave it at that for now. And I'll see you soon for the Africa one. Okay.